the honor to introduce one of our own, Nathan Fiala, who joined our department in 2014. And Nathan has a PhD from the University of Irvine, California Irvine, and a master's in mathematics and behavior from Irvine also, and a bachelor's in economics from Arizona State University. So today's topic is going to be one of the, now things are getting bigger with Nathan, so they have a large-scale experiment in Uganda where he has been working for years. And he has a long pipelines of projects and working papers coming out of Uganda. So, Nathan, so the floor is yours.
Thank you very much. So thank you all for coming. I hope that just because we're being videotaped, this isn't going to slow down the veracity of your comments. So please, this is still early draft work, so I'm going to really appreciate any thoughts or comments you guys have. I say it's an early draft work. I've been working on this project since 2010, I believe, was the first time that I conceived of it. So there's obviously a lot of time that goes ahead of me actually presenting rough drafts to you. So 100% is some work I did with Patrick Freeman, who's at the World Bank. This is a experiment that we did in northern Uganda with the government. I've included this photo here. I wish I could take credit. I'm going to show you two or three photos throughout the presentation. They're all done by my research assistant, so I can't take credit for them. But this is basically the type of gentleman that you should be thinking about while I'm presenting. This is a farmer in the north. He's got 3 cattle here that basically is his main assets and his main consumption supply. So I'm going to be talking about a development program that's going to be working with these types of individuals in the north. Let's get started. So the topic is on social accountability and service delivery. And so let me talk a little bit about what social accountability might mean, about what service delivery might mean first. So service delivery in sub-Saharan Africa is bad. It's not too surprising that most countries in sub-Saharan Africa are way behind on Millennium Development Goals, definitely behind on universal primary enrollment for school. Child mortality is still relatively pretty high in the continent. Quality, it's not just the quantity of these services as well, but also the quality of them is actually quite low. Basic literacy and math scores are just across the board very bad in many countries, and Uganda is absolutely one of those cases. Money is obviously a problem. When you're poor, it's very hard to produce these types of services. But another problem that's been getting a lot more traction, especially in international development circles, is thinking about, when the money is there, when there is money that's being delivered, there's still problems that are rising. And so two of the biggest problems that are being targeted is, first, corruption and mismanagement. So one thing I should make clear before I get started, I'm going to try hard not to just say the word corruption, because like most studies in corruption, I can't actually disentangle pure corruption from mismanagement. And that is, of course, by design. If you're a local official, you don't want to obviously look corrupt. If anything, you would like people to mistake you for just being a little bit incompetent at your job. So the difference between these two is very hard to separate, and I'm not going to be able to do that here. There are other experiments that have been able to separate these things, but in this case, for what I'm going to be presenting, corruption and mismanagement are going to be kind of a black box for us. So that's one problem that people have been commenting on or thinking about. Another one is how citizens interact with these services. So think about development programs that come into a community. If the citizens themselves are not able to use that product or that service or that program, if they're not able to maintain it, water quality systems are a really good example of this. There's been a lot of work bringing in water filtration and water cleaning systems, but communities just tend not to take very good care of these things, and so they don't tend to work. So that's not necessarily corruption or mismanagement by local officials, but by the community themselves not taking care of the project. So let me talk about each of those a little bit. Yeah.
Nathan, since you're on video, right? You have cast aspersions on the government as one explanation, or on the individuals receiving the service as another one. Is perhaps that the programs themselves are poorly designed for the resources that are already available in these regions, somewhat outside of any failings that we might think would be there. So we don't want to just blame the poor for their poverty.
I agree completely. The program I'm going to be talking about is a livestock delivery program. So this is a program that is geared towards these communities. These are, people who generally know how to take care of animals and have a lot of interest in them. It's a program that's really, it's community-driven development. So these are what the communities themselves ask for. But actually, I agree with you. And in a general sense, there's a lot of really bad programs out there. In fact, there's great evidence that most development programs do nothing. Any other concerns about me hitting on the floor? My co-author worries that I hit on the government too much, so it's thank you for the opposite of that. Okay, so what does corruption possibly do? So corruption and mismanagement, they can undermine development. Some of the things that have been put out there is increasing bureaucratic hurdles, making the environment for foreign investment less attractive. Something that more targeted to what I'll be talking about is low quality delivery of health and education services. So there's some nice work, and I'll cite that in just a minute or talk about it. Looking at how mismanagement is really hurting the health system in Uganda. There's also evidence that the corruption and mismanagement affects those with the most to lose from it. So these are the people that are the poorest, with the least voice to be able to push back against it. So in Uganda, so I'll be talking about this group, the IG. This is the Inspectorate of Government. This is the auditing arm of the government of Uganda. This is who is going to be running the program that I was describing. I'll talk about them a little bit more, but they ran some surveys themselves trying to find out about the prevalence of bribes in Uganda, and they found that 61% of people reported to them that they paid a bribe of some kind in the last 12 months. Totaling 20% of a person's annual income. Now that's a cash income, all right? So this isn't literally like 20% of their wealth that they're spending, but it is, the cash income that an individual is earning over time. Spending on. Think about, small type of bribes. You need to get a form filled out. You need to get somebody to help you in the government to just do some simple service. There's going to be a small fee that you're going to end up giving them. I was talking to a colleague of mine who's working with the police. It is illegal for the police to ask you for money to work on your case in Uganda, but that's just the expectation. The police always ask for money. It's some kind of facilitation fee to help them. Oh, you were robbed, something happened to you, well, I need a little bit of money to transport myself to your village, so please give me, $10, local currency. Those are illegal, so those are technically bribes. So what do people do to try and avoid these problems? Well, or governments and organizations. So there's basically, I'm going to split the anti-corruption interventions into two types of things. There's the top-down. This is audits. Right? This is what the Inspector of Government does. They hear about reports of corruption. They hear about local officials. They're doing something they're not supposed to. They come in. They look at the books. They check to make sure everything's right. And if it's not, they're going to prosecute them. So the IG are lawyers. These are the people that come in and try to find the big guys who are actually doing something wrong and prosecute them. Yeah.
This is going to be a lead-up question. What % of citizens' annual income goes to pay income tax?
No. I love it. Every economist is asking me this question.
Why is bribery so bad? I pay 20% of my income for income tax, and thus I get government services. And somebody else has got to pay 20% of their income, but just through a different method. Why is this not just us being persnickety Westerners about how government services are supposed to be funded? At least this is a pay-per-service process. Should be more efficient than what we do with just income taxes, totally separate from the paying for the government services we receive.
So, I guess in some sense, as a heartless economist, I might agree with you. However, maybe a bigger concern might be that these are extremely poor people who, they're not in your income bracket. In America, they would be not taxed. They'd be receiving some kind of government services in America. So this is, generally the bribes are often targeting, the bribery, the people that are paying bribes are often some of the poorest people with the lowest amounts of cash to be able to spend. So I agree with you. If we thought this was just simply a tax rate, maybe that would be fine. What I'm going to show you here today is a lot bigger than this 20% tax rate, but nonetheless, I think that's a valid point from a more macro kind of perspective.
That was generally my question, actually. But the follow-up to that then is there a bribes paid is implication of corruption for you, or?
I won't have any indicator of bribes. I won't know if people pay bribes. So I'll be able to infer that money was transferred out and taken, but I'm not going to be able to see that.
But bribes themselves are evidence of mismanagement,
yes.
As much as potential corruption.
Yeah.
Okay, and that's not going to matter.
Right.
Okay.
Yeah.
Well, my initial reaction as you're starting to talk about bribes was the same as Richard's, thinking that they simply replace income tax with taxes, but I guess in some ways we have more say over our tax rate than Ugandans have over the rate that they pay for bribes. At least that's a possibility. I don't know if that's true here.
So a great answer. I wish I'd thought of that when responding to Richard. No, it's absolutely true. These are also, government services are supposed to be funded through the government, but it's true that police are underpaid and that they're not given proper facilitation by the central government. So in some sense, yes, it's not entirely unfair for the police to be asking for some kind of support to be doing this. Yeah.
So generally, the issue that we have back home concerning is right there. They go to individual pockets. So they will take the money and they give you a receipt and it goes to the account to the government. Then we know that fine, we all pay in some form for a collective good. And these are going to individual pockets, and that's the concern.
Individual pockets that are being underpaid. So, there's some people that I work with in Uganda who are doing, as I said, some interesting work with the police, and it's absolutely a problem that police officers are just underpaid. True everywhere, most everywhere. And so, if you think about this as just simply supplementing a police officer's salary that he should be getting from the government anyway if he were paying taxes, maybe that's not very convincing. I'm now trying to argue for it.
Yeah, but you remember Jeremy Ford's paper about price and the base salary of the police and...
Exactly. So, there's not necessarily a correlate or, not necessarily a relationship between salaries and how much people are asking for bribes. No, absolutely. Okay, but that's not what I'm going to be talking about, all right? That is the approach that's very common. That's the traditional approach, especially in Uganda. That's what the central government does. However, what I'm going to present to you is a bottom-up approach. And this is where citizens and the program beneficiaries themselves are going to be directly monitoring the policymakers and providers for the programs that they're receiving in their community. All right, so citizen accountability, the more I dig into this literature, the less and less I find. It's actually really quite interesting. There's a nice meta-analysis by Molina et al. Looking at the broad evidence across this social accountability. They find some very weak evidence that local monitoring can improve health services, but that's about the most that they can say. And there's been a couple of discussions about how there's just no evidence for large-scale national programs that use social accountability. In fact, there's only one, what I'm going to do is I'm going to split this literature into two different types of topics to maybe kind of help us think about it. So, it's going to come back when I talk about the design. So, one way that you can approach social accountability is through training communities. All right, and there's really only one study that I can cite that does that. So this is the Bjorkman and Svensson study, working with healthcare providers in Uganda. They gave a report card, which is some information on how well the local healthcare provider is doing, and they provided communities 2 half-day trainings on what to do, or what they could do with that information, how to make complaints and how to follow up on these things. They found that a couple of years later, communities were monitoring the providers more, and the providers actually increased their effort levels, leading to actually positive health outcomes in the communities. There was actually decreased infant mortality, I believe. They then did a 4-year follow-up of this study where they also added in a separate experimental arm where rather than giving report cards and doing the trainings, they just gave the trainings, right? And they find no impact from just giving those trainings, but they do find sustained effects from the report card plus the 2-day training. One thing I want to highlight here is that their sample size is pretty small. They actually have 25 communities in the treatment here, and 25 in the control, and then 25 in this additional treatment. So their sample size in the end is only 75 communities. There's a little bit more evidence on just providing information to community. So all these studies I'm going to classify as just providing information. That last study provided report cards, which I classify as information, plus some training. These studies all just do training. Now, the most famous one that people are aware of when it comes to social accountability is Benjamin Oltin's 2007 study in Indonesia. He actually did a really nice experiment. It was a 2x2 experiment where he had auditing from the central government, so top-down auditing, combined with a social accountability component. Except that, to be clear on how social accountability worked in that study, people were invited to meetings where local leaders explained how they used money in a local development project. And this is actually road building in Indonesia. All that happened in that social accountability treatment was that people showed up and supposedly local leaders were saying, hey, we spent the money like this. That's all that it was. So in that case, I'm going to call that also an information treatment. More recently, there's a really good information treatment on report cards for school. Oh, sorry, just to finish up here. That's all the information that was provided. For me, not surprisingly, Ben finds no impacts from that. He actually finds really big impacts from a top-down auditing component that they did, no impacts from the community monitoring. However, there were impacts in this recently published study in AER this year on school performance in Pakistan. So the researchers gave report cards to parents about the quality of the school relative to other schools, so it's absolute and relative information, and they found that, in fact, the schools ended up making more effort, and there was even a market spillover where it looked like schools started to compete a bit more for people. So that was actually kind of a really interesting study. However, the evidence keeps getting a bit more mixed here. So Banerjee et al. In 2010 had scorecards on child education in India, so it's a very similar type of study where they delivered information on the quality of the education system in some villages, but they find no impact. In 2016, Banerjee and some other co-authors mailed information to beneficiaries of a rice program in Indonesia, and they found that the beneficiaries received more rice. So this is just telling people, look, there's a rice delivery program that's coming to your village. You have the right to get this much rice. Right? That's all the information. And they did find that worked. There's another study by Abigail Barr and co-authors, still not published, so it's still a working paper. But they had community-created scorecards. This is where they went into communities in Uganda and had the communities create a scorecard about the schools themselves, looking for teacher absenteeism. They didn't find many effects there, a little bit, but a little bit mixed. So I would say that the evidence so far on just providing information is mixed at best, although there has been some success stories. Yeah.
For this Pakistan study, is that the schools improved or there was cream skimming?
No, that's actually what they found is that what was most interesting is there was not cream skimming. So actually, in fact, Asim was just here earlier this week, so I had a nice long conversation with him about this. He thinks what was interesting was that they delivered a scorecard in 1 year and said, hey, your school is really bad. And we're going to come back in a year later and we're going to give you a new scorecard. And so what they found is that students actually weren't moving schools. Parents kept their kids in the school. He believes because there was the expectation that more information is going to come. If the school is still doing badly, then we're going to get out. But they found some pretty big effects, pretty big increases in the quality of that school. Yeah.
It's about the comment about results being mixed. I think if I just look at it and include the health example before, more than being mixed, it's sort of like look to be more heterogeneous. For example, if you look at things like education and health, it may very well be possible that the amount of capital and the amount of bureaucracy going into, for example, building roads and bridges is so big that it's so hard for people sitting at the town to monitor them, while health and education is something in their community. So
however, I mean, there is a difference between these two studies, because I think this one was a lot more intense. So I think the program details matter. But it's a fairly similar context and at least a fairly similar approach. And one group of researchers didn't find impact, another one did. So there's probably more going on here than just providing information, I guess is what I'm trying to say, is that there's got to be, you know, a bigger component to it than just mailing out cards saying, hey, you know, your school is not doing well. You've got to, you know, add in a lot more to make that really impactful. But I think context matters a lot. So I think if, you know, what I'm going to be working, or the people that I'll be talking about today, we're working with extremely poor people who are not used to making complaints. In fact, they're not used to even leaving their village for the most part. So I think this is a community that if you gave them information, it may be very hard for them to use it, and I'll show you that it was very hard for them to use it. Yeah. So I think context matters quite a lot. Okay, so what I'm going to show you is a 2x2 experiment on citizen training and information. So we're going to have a training component, and we're going to have an information component, and we're going to interact this too, and then I'm going to have a control group. I'm going to be able to talk a little bit on potential mechanisms and what I'm going to call distribution effects, but I'm happy if people want to push back on whether I should be using that term or not here. The sample size is really large. I'm going to show you a subsample of what we did, but the whole sample is over 1,000 communities that we worked with. It's actually almost 8 times as many clusters as some of the studies that I mentioned before. We're also really well powered. We have power for minimum detectable effect sizes of less than 10%. I had designed it for a power of 8%. Once I looked at the ex post data, it looks like we could have done at least 10%. What's also interesting here is that the intervention was managed by the government, all right, in cooperation with local civil society organizations. So there's a lot of concern among researchers that small pilots aren't really reflecting what happens in the real world and how you might want to scale up these programs. Basically, we're going to be operating this thing at scale. This is already at a scale that is, you know, possible for the government of Uganda to be implementing. You know, if I have time at the end, I'll comment on how they are actually going to be scaling this up even further than what we did. So before I get started with the design, I should just comment on the structure of government in Uganda, because this is going to get confusing, and I'm going to apologize. I hope that I'm going to do the best job I can explaining what's going on, because there are a lot of moving pieces here. But let me just talk about the structure of government in Uganda. So first off, we have villages. This is what I'm also going to refer to as communities. They have a local leader who's elected. He's called the LC1. This is in the context of a community-driven development project, and what that means is that the community, the village people, come together and decide on a project. So there's going to be a lot of things that are happening here, and it's all outside of my experiment. I have absolutely no idea what's going on there, but it's you know, something important is happening there. Then at a higher level, there's the sub-county. All right, and this is an administrative unit that became very important in the program that I'm going to be talking about. It's called UCTV. I'll talk about it in just a second. There's a local elected official called an LC3 and a bunch of bureaucrats who are also at the sub-county level. And then the program representative is going to also be based in the sub-county. So villages are going to come up with proposals. They're going to hand them to the sub-county to be approved. Once they're approved in the sub-county, they're going to be handed to the district. The district is composed of, again, an elected LC5 and some other bureaucrats who are going to be looking at proposals and approving them, and then they're going to hand them up to the central government, which is the Office of the Prime Minister, who is the main body that's going to be operating the bigger program that we're talking about, and then the Inspector of Government, who are side by side. One's implementing the program, the other one's going to be monitoring what's going on.
Can I ask a dumb question?
Yeah.
Why is this a triangle?
Because
It's representative of the number of people.
I'm the absolute worst at graphical depiction. So there are tens of thousands of villages,
Okay, that's what I'm
500 sub-counties.
So this is the number of
50
people that are in
districts.
charge of villages versus the number of people that are in charge of sub-counties.
Yes,
versus-
sure.
And this is representative of this. The central government is very small in size. Is that what that was supposed to be?
Oh, yeah, yes. So Uganda's gone through a decentralization process, so a lot has been pushed down to the local governments.
This is numbers of people, not like control of budgets or something like that.
Right. So you think, yeah, so it gets smaller and smaller numbers of people, but the power of budget is going to really come at the district level. And then the central government is the one that hands out the money to the districts, and the districts make decisions about how to spend it. Okay, so this is where it's going to get a little bit confusing, because I'm actually going to be talking about 3 different programs. One of them that's outside of my control, but you need to understand it. So there's the Northern Ugandan Social Action Fund. It's the second version of it, so it's called NUSAP 2. It's a $130 million community-driven development project funded by the World Bank, managed by the Office of the Prime Minister. And so I gave you kind of a preview of what community-driven development means. What that means is that communities pick projects from a menu, all right, and they're given a menu and they say you can pick any one of these types of projects that you want to happen in your community. They pick one, they sit down, they write a proposal. All right, they then submit that to the sub-county, as I described, and then the district, and then it gets passed all the way up. And for some reason, whatever the decision-making process is, at some point it's decided by the central government that they're going to fund a project. The central government then transfers funds to the district, who then hands it to the community. There's a large menu of things that the communities could be doing, and we worked with quite a few different types of projects, so livestock, infrastructure, and a couple of others. What I'm going to do today, just to simplify this presentation, is to just talk about the livestock projects. And that's because that's where I'm going to get my 2x2 experiment. If anybody's worried, I have slides at the end that I can show you that, in fact, most of what I'm talking about probably applies to all the projects all the project types that we had. But for the sake of simplicity today, I'm going to just focus in on the livestock. Yeah.
So on the previous slide, when you had the previous slide, you were talking about the village leaders are in charge of a development project. Is that their whole? Is that
no? So the village leader is in charge of the the village and what's going on in the village. In the context of NewSAP 2, there's going to be a separate committee, group of people that are going to be in charge of the NewSAP 2 program.
Got it.
And so this committee comes together, and I don't really understand how it happens in community-driven development projects. There's been some research on this topic, but it's it looks like it's a little bit regressive. We're not necessarily talking about the poorest people in the village who are coming together and benefiting. But it's a group that comes together, they form committees, they form a group of people, they write a proposal together. They're also not doing it entirely on their own. There's an individual called a facilitator who goes around to different communities and helps them kind of writing these things up because it is quite complicated to write it. So when you're writing a proposal for a livestock project, what you're writing down is, okay, we want to get 10 cattle and 1 bull. We're going to go to the market, we're going to buy these. This is the market we're going to go to, this is how much we expect to spend. We also need a little bit of money to get vaccinations and some other things that we might need for the animals as well. That's a really standard type of proposal for a livestock project, and I'll show you in a minute. It comes to about 11 million Ugandan shillings, which is, oh, now I'm forgetting. I think that's something like $3,000 per community. Okay, so under NewSAP 2, about 10,000 projects were funded over the span of 5 years. So this is too big of a program, they couldn't fund all 10,000 at once, so they went in and did tranches. And so what we did is we came in at the 7th and 8th tranche of funding. All right, we got the list of projects that they were going to fund, and that's where we're going to do our experiment. Every community in the experiment that I'm going to show you, everyone, treatment and control, everyone received NewSAP 2. All right, that's really important. I don't have any control over that. I didn't randomize NewSAP 2. Somebody else tried to and failed. I wasn't dealing with that, but the point here is that everybody received the NewSAP 2 program. So the communities are responsible for the implementation of that once the funding is received. So it comes to a community bank account. People from the community are supposed to go to the bank, withdraw the money, go to the market, buy the animals, or contract other services that they need. The government is there to facilitate, not to manage. So there's a veterinarian officer at the district who's supposed to come by and help people we can check and make sure the animals are of good quality. The district vet is not supposed to come in and say, hey, I hear you got the money, give it to me, I'll go get you some good animals. That is not the role of the district vet, and in fact, that is a big part of why we did what we did, because this was a common story that we would hear. Somebody from the sub-county or somebody from the district would come to a community and say, let me help you out. All right, so there's a couple of things that might actually happen with service delivery in NewSAP 2. So there could be outright corruption. That could be government officials stealing money from the communities. All right, I'm the district vet. I say, let me buy you some animals. I go out, I pocket a couple million shillings of your money, and then I buy some inferior quality animals, and you get 10 lower quality animals than you would necessarily.
I wanted to bring this up because you bought it buying animals so many times so far.
Yeah.
I was going to look, but I won't. How many, where do the animals come from that you buy in this type of program?
So they are from local markets, and the local markets are actually pretty good when it comes to buying animals. So you don't go to a market just any day and find animals. So about once a month.
So who brings animals to the local market?
So that's going to be people who are trucking them in from all over the place. They could be imported from Kenya, They could be coming from the southern part of the country. They could be coming from other parts of the north. It could be people that are just selling their animal in a market. It's really all over.
But they're mostly coming from outside of the beneficiary targets?
No,
of these
not
programs?
necessarily. Not necessarily.
You worried about general equilibrium kind of impacts from the distribution?
Well, for NewSAP too, sure. I mean, it's absolutely possible. In fact, I'm doing some work with government on free seed distribution, where we know it's having huge general equilibrium effects because the government's demanding huge amounts of seed. 10,000 projects, not all of them were livestock, about 2/3 of them were. Multiply that by 10, that's how many animals were purchased under the NewSAP program. So absolutely, that could be happening. Yeah, I haven't heard about situations where there were, you go to a market where there's supposed to be livestock and there's none. But absolutely there could have been price effects that were happening.
Who is then manage this project? The local village?
Yeah, the village. The village committee.
So there is no one to be accountability for, like they are taking money from the central government or district, so there is
So-
no accountability for this money?
So there's not necessarily. So the money is coming from the central government to the community buys it. Now, the design, the intent of the program is that the community wants this, so the community is going to, demand accountability for it. That doesn't happen, and that's why we're coming in. The central government or the local government, comes in and may just check in to make sure that, okay, does everybody have animals now? They're not necessarily checking to see the quality of the animal. They're not necessarily checking to see where you bought them, whether it's really your animal or whether you borrowed it from your neighbor to show off when somebody comes by. That kind of accountability just doesn't exist. So this is, I don't want to describe USAP as an unconditional transfer program, because there are conditions to it, and it's a little bit more complicated than a completely unconditional one. But once you receive the program, there's not much oversight. Yeah.
So, have you ever thought about the potential welfare loss when you have to randomize this kind of project? If the government has some information so that they can better target these projects?
Absolutely. So, sorry, you mean local officials might have more information than the community?
So, if the government does not have to randomize these projects, right? So if they have some information, they can better target this kind of project. Versus when you do a research, you have to have a clean design. You have to control.
Well, so NewSAP is not randomized, so they're giving this to everybody. But I'm going to find, that's where I'm going to argue that I have distribution effects. It's basically a heterogeneity,
Okay.
and so there are targeting things that could be done better here. Absolutely. Yeah.
Suppose community has a terrible proposal. Do they sort of mind?
No, theoretically not. It's supposed to be reviewed by a bunch of people, and the bureaucrats are looking at it and saying this is not going to work. This is a terrible idea. But I don't know what.
That does kind of get into Humphrey's question. What's the rejection rate on these things?
Oh, so to get to these 10,000 projects that are funded, I wouldn't be surprised if there's 20, 30,000 projects that were proposed. But the process of getting the project through the proposal process is not always about quality. All right. I think there's some good evidence from other research, not here, that who in the government is going to be a big part of whether or not you get that funding. So just to move on, so other problems. So we could have corruption where government officials are literally just stealing money from the communities. You could have mismanagement. The money is being used inefficiently, either by the local community or by government people. You could have problems with community action. So communities can fail to implement the project because it was too difficult to organize around, or maybe they didn't do it very well because it was just very difficult to organize. And you can also imagine there could be beneficiary inaction. People may just not take care of their own projects. All right, I'm not going to really be able to comment too much on this last one because this is going to be more of like a social sanctioning problem that could be happening. But I just want to mention these are the different types of things that could go wrong in the project and the things that we were thinking about when designing this. So the interventions that we're actually going to do, this is what we actually randomize. So the first is a social accountability training. That's where we're going to, so as I said, it's run by the Inspector of Government, with an emphasis on bottom-up accountability. We're going to, the CSO representative is going to go into the community. They're going to have a day of mobilization where they're going to get together a new volunteer committee that's going to help organize for monitoring of the project. Then they're going to come back and do 3 days of training on that committee and anybody else in the community that wants to come to it. It's a completely open meeting. And then we're going to have 3 follow-up visits where the CSO representative is not there to manage things that are going on, but to advise them on how they can make better actions. And I'll talk about the training in a little more detail. So that's one component. The other thing that we're going to do is after we do the training, we're going to go into communities and do an assessment of their project. And we're going to use the information from that assessment to talk about the impacts of the training in the short run. And then we're going to use that to create a scorecard. We're going to take that scorecard, it's going to be, so I say an audit assessment on the quality and quantity of the new SAF2 project that people got. We only did it in the livestock projects because I couldn't figure out how to compare roads to livestock. That was already too complicated. We present the information to the group, to the communities as a group by the research team. So it's not the CSOs doing this just for convenience. The research team went in and did it quickly. We talk about their relative performance and their absolute performance. All right, so you were supposed to get this many animals. This many are still alive at the time that we did the assessment. And by the way, another community in your district has way more animals still alive than you do. That type of information. And we're going to rank them within the district and say, you're the worst, you're the best, you're somewhere in between, something like that. And then we had a facilitated discussion about the results because we wanted people to feel like this is something they can act on, that they can actually take that information and do something with it. We left them physical copies of our scorecard, all right, in English and the local language. So this is things that they can take and make actions on if they wanted to. So I can already tell there's no way I'm going to get to all my results, so let me just tell you right now what we find. So we find that the training had a modest impact on initial project quality. That's going to be that assessment that we do. We then find that over time, a little bit later on, we do another follow-up data collection, and we find that the combination of the training and the scorecard interventions has really big impacts on household welfare. And that's going to be measured through assets, specifically through number of cattle, but I also will show you total assets in the household. I don't find any impacts from training only, and I don't find any impacts from the scorecard only. All right, it's the combination of the two that are going to matter over time. I'm going to show you, thinking about some of the mechanisms, I'm going to show you the program increased monitoring of projects and a very large increase in complaints to government. I won't have time, but we did a separate experiment with the enumerators. It's a separate paper, so that I can argue that this is probably not a mismeasurement problem. And then I'm going to show you evidence that the program had the biggest impacts in areas that were perceived to be the most corrupt. And I'll talk about how we come up with that indicator in a little bit. I also find, thinking about some secondary downstream impacts, I see increased trust in the central government. We don't find any spillover effects to non-treated communities. All right, so there is there's the potential that we train one community and it could spill over into another. We don't find that to happen. But we do find that within communities, people report making complaints about other non-NUSAF related projects. And for some reason, I don't have it in here, so I'm really nervous why I left it out. But a big impact that we find is people report to us a higher rate of being able to solve public goods problems. So actually community coming together and actually solving problems collectively, at least as far as people reporting to us, we see an increase in that. So I think that actually could be a big part of the mechanisms as well. Okay, so this is northern Uganda. It's a landlocked country. This is the Congo, South Sudan, Kenya. We've got Tanzania down here, and this is the lake. When I say North Uganda, I mean cut the country in half, and it's the top half. For political reasons, northern Uganda has just expanded very largely. So we're talking about a large section of the country. Don't pay too much attention to the details here, other than to say that we're spread all across the north of the place. This is just different communities that are part of the sample. And there's obviously some areas where there's no communities because they weren't part of the 7th and 8th tranche of funding that we were working with. Yeah.
Question in the previous slides in the intervention.
Yeah.
So what was the time difference between getting your project improved and your intervention coming in?
Let me show you that in just a second. I'm going to have my next really bad graphical depiction. Probably even worse than the triangle. Oh, it's right there. All right. So this is the timeline. So back in January 2013, we did a survey with local officials. Right? And this is where I'm going to get this indicator about where are the most corrupt places, and I'll talk about that data in just a second. Later on in that year, we obtained a list of the NUSAF2 projects that were going to be funded under the 7th and 8th tranches. We then randomized the projects in early 2014. Notice that there's no baseline survey before the program begins. We did not have the opportunity to go into the communities and do a baseline. So the randomization happened without any data on them. But I will give you some balance tests in case you're concerned. So the program, the NUSAF2 program and the social accountability training started in June 2014. Now, the idea here, two there. The idea here is that the communities are supposed to get the new SAF2 money, and then soon after they're going to get the training. And so we did actually an audit, a process evaluation, if you will, about how well that worked in a random sample of about 95 communities. And we found that I think it was for about 85% of the communities, the timing was actually really quite close to when it was supposed to be done. However, that doesn't mean that all the programs were finished in a really timely manner, because from June 2014 to October 2015 is when the whole project is being implemented, with a mean completion date of June 2015. Now, why is it so big? Well, I glossed over all the other types of projects that are in this sample. For a livestock project, it's literally could be done in a month. The community gets the money, they go out and they buy the animals a couple weeks later. For some of the other infrastructure things, including roads and teachers' houses, they would get money, they'd start a little bit of it, the government would then send them a little bit more money. So that all became a very long, drawn-out process. We're also working with 2 tranches here, so it's one of those situations where when you're doing very large experiments, the timing doesn't always come out really clean. But we're just going to be focused on the mean completion date of June. We then do a project assessment at the end of 2015. Right, so it's only about 6 months after the mean completion date. But this is where we're getting this information that we're going to be using for the scorecard. But we're also, I'm going to show you analysis using that project assessment data. Right after we got the assessment information, we created the scorecards and presented them to communities. Right, the timing there was on purpose. I have another paper that I'm working on with political outcomes, because the election in Uganda happened in April. Right, so our intent here was actually to try and affect how people interacted with local government from a voting perspective, but also from the programmatic. And then we do a household survey where I'm going to be talking about the assets, the household welfare, about another 6 months after that. Does that answer your question? No. Okay, so the training curriculum, just really quickly, we had the community, 7 modules. As I said, the only other study that I really can compare this to had 2 half-day trainings, so what we're doing here is relatively really intense. All right, so we talked to the communities about mobilization, introduction to social accountability, how social accountability works with NewSAF, how to generate a community action plan, which nobody ever did, but it was theoretically something they could be creating. Post-monitoring activities, applying lessons learned to other government services. We specifically wanted them to use this for other things happening in their community. And of course the follow-up support. And the program, the training was heavily visual. So let me give you an example right here. We've got a livestock project, and this is also, at least anecdotally, a common problem in these types of projects. So here we got some local villager. This is his wife. She's got some dying cattle. He goes to the group and says, hey, I know we need to purchase some cows. You guys should buy the cows for my wife. All right, so it's a nepotism problem, because now it's, the community is buying from somebody who maybe they weren't especially supposed to be doing. They're not buying it from the market, they're just buying it from somebody in the community. And they're also getting very low quality animals while doing it. Death of animals is a real big problem. Certainly there's a lot of stories that I've heard about people buying animals and then just really shortly afterwards dying. So we can have situations where we've got really, really low quality. You can also have situations where you're paying somebody to. So this is the district vet, right? So he comes in and he says, hey, give me a little bit of money and I'll tell the community that your goats are really great. And so in that case, the community is getting really crappy goats, but the vet is saying everything's okay. So, and then we talked a lot about, well, what can you do? So you can meet with local officials, with local government. You can make reports to the inspector of government. You can, what are some of the key monitoring areas? So I should find the livestock one to make that a little bit clear. And what can you do? So in the case of a house, you actually have the right to stop the work and maybe even tear it down and tell the contractor to start again. With animals, you do have the right to go back to the person that you bought them from and say, hey, we found out these are really crappy animals. Give us better animals. Like we paid for. And this is an example of the scorecard that we gave. So what we have here is there'll be some project name. We have compared your project with 33 other projects in your district. Your rank, you got 21 out of 33 for the health of your animals. For the productivity, you're ranked 22. From assistance from your local vet, you got 7. and the value for money, you're ranked 20th. So your overall score, we give them an absolute score that you got a 69 out of 100, and that gives you an overall ranking of 12 out of 33 communities. So then we showed them a number line and said, your points are here, and you're in the bottom third. So this is the basic information that we provided. We gave out copies of these to the community so they could keep it. We facilitated those discussions around it, and we had lots of presentations about each one of these individual things, and we talked to the communities, why do you think you did poorly on these scores? What do you think was some of the problems that you encountered? What can you do going forward to try and solve those? And so this is the experimental design that I'm going to show you. Now, I told you that in the full experiment we have over 1,000 projects. However, I'm concentrating here again on the livestock only, and so that's going to leave us with 574. I'm doing that because it's going to save a whole bunch of time for talking about things that aren't necessary. But also, we only did the scorecard treatment on the livestock, so this is where the 2x2 design comes in. So these cells are, you might notice that the training is about twice the size. The treatment for training was about twice the size of the control. That was done on purpose. The government wanted to be implementing this program, and so we just have a larger number of communities that we did the training in. However, the scorecard was basically evenly distributed across things. And so now I'm going to have pure control communities. I'm going to have communities that have both, and I'm going to have communities that have only one or the other. So now I'm going to talk about the data. This is, if I had the time, this is a really exciting thing to get into. This is one of my enumerators putting his hand down the throat of a cow. He's trained by a vet. Then we sent them out to actually get quality indicators of the projects. In this case, this is the animal that he's doing. So we're going to have indicators on animals and the animal health. We're going to have indicators about whether they're bought at the correct age, at a certain age that you're supposed to be buying the animals. I'm not a veterinarian, so I'm only pretending to know any of this information is correct. There's also improved breeds that are available in Uganda. In some areas, they're not appropriate. So it could actually be a bad idea to have an improved breed in some parts of Uganda. But for the most part, they're a positive thing. They're more productive. They have better quality. We also have an indicator of how productive the animal is. Are they producing milk? Are they producing children? Other things like that. Are they actually able to pull? I'd say children. Calves. Thank you. All right. Are they actually able to pull? The plows in the fields that they're supposed to be doing? And then we also have this indicator of fraction of animals dead, stolen, or sold. It may be strange for me to kind of group those things together. If your animal is dead, that's going to indicate to me that it was a pretty low quality animal that you had, or else you took really poor care of it. If your animal was sold, all right, you're only allowed, and this is where some monitoring did happen in this program, you're only allowed to sell the animal if it's about to die. So if you're selling it, either something's really going wrong in your household and you're trying to, sneak out and sell it so you need a little bit of cash, or the animal's about to die so you might as well get rid of it anyway. And then we have a very small number of animals that were stolen, but this is basically grouping all of them into animals that we couldn't observe and what was the reason for not observing. Again, this is for the initial project assessment. Yeah?
You just started interspersing the word household.
Yeah.
And everything that you've talked about has been the village.
Yes.
So
in fact, the program is implemented at the village, but the most common design is that 10 people within a village got an animal. Got a cow. So it's the household that receives, in this case, the beneficiaries here are the household that receive the animal. All right. So when I say individual, I should really be saying household, but so there's multiple animals that are delivered per community. And that's actually going to be nice. One of the first results I'm going to be able to show you is I'm going to show you results at the animal level, clustered at the community. I also have whether or not the project is missing. I don't think I'm going to have time to talk about that, but I think that's actually a really interesting topic. So when we get to that result, we'll see. Procurement and contracting process, and then the intensity of community monitoring. Right? So this is all the information that we were going to collect in the beginning. And of course, we used this project score to create that scorecard. Then, as I said, we did a household survey. That's going to be our final end line that we do in the community. This is where we're going to a random selection of people that were listed on the project proposals. So we know who was supposed to get an animal. we pre-selected who we were going to visit, and we went and found those people. And in that survey, we're going to do household assets, individual monitoring and complaints to the government, whether they trust the government, whether or not they think the community is able to provide public goods. I'm not going to show you here, but we also have to have political participation, as I said, and we have this little experiment with the enumerators to test for potential enumerator bias. And then the last piece of data, this is what's collected before the program began. And this is from our local leader survey. So what we did is we interviewed every leader at every level of government, at the sub-county and the district level, in the areas, the broad areas that we were going to be working in. And we're going to use one question from that survey, only one question. So if anybody's interested in a survey over 1,500 local officials with lots and lots of personality data, which I have no idea what to do with. If anybody's interested in that, I got it. But what we're going to use from that survey is just this one question. In your personal opinion, within your district, which sub-county has the biggest problem with corruption? Now I'm going to use this as a vote. All right, in 2/3 of the community, 2/3 of the sub-counties either got a 0 or a 1. But in 1/3 of them, they were actually mentioned a lot more than than 1. And so I'm just going to turn that into a binary indicator. It's going to tell me what are the places that are perceived by other officials to be corrupt places. Now, there's of course a problem here with the definitions here, so I'm using this word corruption. Right? That could be capturing many things. Again, it could be mismanagement. I'm not going to claim that this is perfectly capturing who is corrupt. All right? What I think this is capturing is the places that are having the hardest time for providing service delivery to communities. As I said, I don't have a baseline survey, but I can give you a quick balance test. So I know the amount of money that a project was supposed to receive, and I knew that before I did the randomization. I also know when the project started, this corruption perception question that I just showed you, whether or not the person that we randomly selected out of the list was a man or a woman, whether they can read or write. This information is from the list that we have. This information is from the survey, the household survey that we did at the end. And then I also know how far their house or community is from the sub-county headquarters. Think about that as kind of like an indicator of how remote they are. And so I'm showing you the training scorecard and the scorecard by interaction with training. The important thing here is that nothing is significant, and relative to control means everything is very, very small. So if you're going to believe me that, okay, I don't have a baseline, but I've got some indicators, and they look to be pretty well balanced. So the estimation model I'm going to present to you, what I'm going to be testing for is a training effect, a scorecard effect, and then the interaction of those two. Keep in mind that this is going to be, say, the additional impact off of these two things. So if we want to know what's the total effect of the scorecard, right, we need to make sure that we're adding our betas together and doing a joint test. All right, and so I found a way to maybe visualize that a little bit better. We'll see if that makes sense. For all my individual level outcomes, which today all I'm going to show you are individual level outcomes, they're all going to be clustered at the project level because the randomization was done, the clustered at the community level because all the randomization was done at the community. Okay, so this is the first set of results that we had from our assessment. This is where we're looking at our scores. So we have a total livestock score. That total score is going to be composed of the quality of the animals times the quantity of the animals. All right, so this is going to be the total outcome. This is the thing I'm most interested in. But then I'll show you all of the components of it. And so this quality indicator is also composed of, what's the animal body, correct age, improved breed, productive, animal health, and whether it was missing. So we don't find much on the livestock score. We see a very modest effect. Significance. We don't see much that's significant, statistically significant on the livestock score. We do see a little bit on the quality score. We actually see, it looks like much of this is coming actually from the number of animals that were dead. All right, so this suggests to me that, if we're talking about quality, these were probably very low quality animals.
What are these? What's a livestock score? What's livestock quality?
So quantity is just the number of animals, and then the quality is composed of all these things. So these are indices. So these are the individual components of the index, 0, 1s. This itself is also an index of a bunch of animal health stuff. And this is 0, 1 also for whether it's missing.
What's livestock quality? This is a scale of...
It's a quality, so it's all these things added together. And then renormalized. This is a standard deviation. So we find a 0.1 standard deviation increase in the quality of animals from just providing the training. So again, this is before the scorecard was delivered, so I have no scorecard results here. We're going to use that information to create the scorecard. But the initial results suggest that there was some very small, modest impacts on the projects from the training.
So livestock quality is just the sum of the measures in 4, 5, and 6.
Yes, and then renal was 4, 5, 6, 7, yeah, and then renal was.
So all the livestock quality result is coming from the animal health result.
Yes. So I could show you just that, but I'm showing you all the individual components. I should also mention that everything that I'm showing you today was pre-registered. So the analysis was already predetermined before we ever did data collection. And I'm not doing any multiple hypothesis correction because my main outcome of interest is just this one. Right? It's really only one main outcome of interest, but I'm showing you all the components that we can see where some of that might be coming from.
So what's the difference between score and quality?
The score is these two things multiplied by each other.
And these are numbers of animals, 28, 25.
Yes, yeah, that's the sample size at the animal level. Yeah.
Now, there are lots of things that you can do with livestock, and you gave 3 examples. Does the distribution of, right, we as a community are going to get 1 bull and 10 cows. And what we're going to do is create more animals for feed. Or we are going to get 10 steers for the purposes of plow animals. Or we're going to get 10 cows for the purposes of milk production. Right? Each of those are 3, and you would expect different outcomes from all 3 of those projects. What does sort of the gender balance of these things?
No, this is a big problem that we have. So I'm not showing you the table where it gets even more confusing, where I have non-livestock projects. Because now you're talking about comparing a milking cow to a field animal. Well, it gets even harder when I'm trying to compare that to a road.
But I'm not asking you to compare a road, I'm asking you to do it for these different.
But, well, I do that also. I'm just saying that, yeah, it's really, really hard.
Yeah.
And so the best that we could come up with here to do this test is to try to come up with some normalized indices and then run tests over that. I think it's a rough way to do it, and this is not the main outcome that I want to show you. This is just to show you some of the initial movement that might have been happening from the training. But I agree, this is a really rough way to do it.
I probably would have liked to have seen what the balance tests, to see what the balance of the animal distribution looked like.
I don't have any of that pre-treatment. So but I couldn't have that pre-treatment because the treatment is happening at the same time that they're purchasing the animals. However, what I can show you is where I do the exact same thing here, but then I add in the scorecard, because remember the scorecard doesn't happen until later. So we would not expect, if my randomization worked properly, we wouldn't expect anything to be significant for the scorecard treatment, and it's not. And if anything, things get a little bit bigger in the training component. So I can't really do a balance on the animals for the training, but I can do it for the scorecard. So I can say that the scorecard is going to be balanced both from these indicators that either existed before the project or things that were unlikely to change due to the project. And the scorecard is not unbalanced with any of the quality indicators of the animals.
So just before we move on, why is the N different?
So we just have missing data for a lot of these things. I mean,
How do you construct an index with missing data points?
Oh, you're right. This one. Let me double check that.
Okay.
Thank you. So if anything, that should be the opposite. No.
Assuming that it'd be 0, maybe it's going to be.
Yeah. So I don't think we treat any of our missing as zeros in this analysis. But we'll double check that. Letitia is helping me with this analysis. Okay. So this is really the big impact that I want to talk about, and this is the household assets. This is measured after people, so they did the training, they got the training, we did the assessment, they get the scorecard. All right, 6 months later, we're now coming in and checking on household assets. So I'm going to show you cattle. So it's the number of animals and all assets. Important thing for this, in my assessment, I have all these indicators of quality of the animal. I'm not doing that anymore. Right? All we're looking at is counts. Right? So the idea is that this is about a year after people receive their new SAP2 program. Animals that are not going to survive for very long are probably already dead. All right? Animals that are going to be productive and are actually creating calves are going to already be multiplying. All right? So these first 4 columns are counts. So it's the number of animals. So the first thing you should notice is that in the control group, these aren't people with just 1 animal. All right? So if these are people that didn't have an animal before and they get 1 animal from NewSAP, they should have about 1 animal in the control group, but they don't. They have on average a little bit over 2. All right? So either they're, the animals are growing really quickly, or these people didn't have 0 animals to begin with. And I think that second one is more likely. And then the all assets is also a count, but this is a count of all the assets in a household, and then we do a principal component analysis to create one index, and so these are going to be standard deviations over here. This is pure counting. All right. So what I'm showing you here is, okay, if I just look at the training impacts, this is unconditional on my full design. This is just did you get training? I see a large increase in animals. That's of 0.32 animals, additional animals per household. I see about the same thing for the scorecard. If I interact the training in the scorecard, this is a fairly large, it's about half an animal more per household if you receive both the training and the scorecard. Now the reason I'm doing this is because I'm also showing here all these things together in one regression, but this is a little bit awkward because then my interaction here is not significant. I also then add up the coefficients, that's the total interaction effect, and then I do this joint test, which I said my beta 1 plus beta 2 plus beta 3. All right, and so this is the significance level of this total interaction effect. And then I'm also testing to see whether or not the training and the scorecard are equal to each other. So the real takeaway here is that somewhere between a half and 0.6 additional animals in households that receive both the training and the scorecard, and nothing significant for just training or just scorecard. Joe.
So I'm going to ask the question, even though I know the econometric answer to it, so you can give that if you want. What's the mechanism in your mind that training and scorecard lead to more counts?
So I think this goes back to the context question. All right, so I presented some evidence that information does. So you're getting to my last slide, but I'll just say it now because I don't know how well I'm going to be able to get to it. Information alone, I give you some mixed results for information alone. Sometimes it works, sometimes it doesn't. I think it matters on the context and the communities. It matters in the context of how you deliver that information. And then I showed you another experiment that combined both these things. That was the training and the information one by Bjorkman and Svensson that I cited. So I think what's happening here is that information alone is probably not doing enough, and just getting training alone isn't necessarily doing much. Getting the training and then having somebody coming in and say, by the way, you're doing really poorly relative to other people in your district, is probably kicking people into gear to make complaints. Now, what do you do at the point when you've got this, once you've got the scorecard, what do you do? All right, so that's where I'm going to show you some of the mechanisms. I think it's coming through people making a lot of complaints to government, and government coming in and trying to solve some of those problems. Trying to solve the quality problem with some of those animals, trying to replace them. It's also possible that the scorecard could have gotten other people in the community to say, hey, you're not taking care of your animals, start taking care of them. So this could be a social sanctioning thing. I can't comment on that mechanism. I don't have any indicators for that. It could also be that maybe the corruption was at a very local level. It was actually in the community, and somebody says, I knew that we were doing poorly. It's not just because we're in a poor area. Everybody in the district is poor. Why are we doing so poorly relative to other people in the district? It's because you guys stole the animals from me, you didn't give me good quality animals, and so there could be some kind of bargaining process that's happening within the communities. So some of that I can disentangle, and some of it I cannot. But again, I do have evidence that communities are making a lot more complaints to everyone, local and national government, and that they're at least reporting that they're able to solve kind of collective action problems. Yeah?
Just wondering, I want to understand, in terms of relevance, how is an increase of 0.35 cows translate to...
I'm going to give you my cost-benefit analysis in the last slide. So maybe that'll answer it. So just for the sake of time, let me just move on. I've already talked about some of my potential mechanisms here. Let me just show them to you. I've got indicators of monitoring complaints to government. These first two came, I mentioned these at the assessment, so these were before the scorecard. All right, so these are actually at the community level. And I do find, the training did increase reporting and complaining in the short run. But what I see is some really large effects. And again, pay attention to this line here, which is my joint significance. Really huge joint significance for the interaction of this, and also some individual things that are significant here. So we've got reporting to the LC1, that's your village leader, to your sub-county, to the district, and then complaints all the way up to the IG. Right? It's really rare for people to make complaints to the IG. Now our control mean is 0.256. So there were complaints that were made in general, but in fact we're seeing really, really large increases in this. If we add these coefficients together, I should have done that already, but that's like 0.25, so basically doubling the amount of complaints that are made to the inspector of government. And then I also sum all these things together, so it's the total number of complaints that are being made, and that is also basically doubling from the control, or no, not doubling, sorry. It's a pretty large increase, about a 50% increase in complaint. Yeah.
So I think you just said these are increases relative to the control.
Yes. Yeah. So these are you can't see it because I got it way down here at the bottom, but these are the control means here.
I can see it.
Well, look at it relative to that. So to be clear, let me be clear here. We're talking about 0.5 additional animals per household. All right, that's a treatment effect of like around 20% relative to the control group. But it absolutely means that they got an additional half animal in their house. I've actually got this newspaper report of one of our treatment communities going to the inspector of government complaining about a local news staff official that, as I had given the example before, had come in and said, hey, I heard you got the money, let's go buy those animals for you. They made the complaint to the IG, and the inspector of government arrested the person. All right, so we actually see arrests that are being done through one of these treatment communities, which was just really surprising to me. This is also done in Karamoja. This is a remote, very difficult place to be working in. If you know much about Uganda, you'd be shocked to hear the communities make any complaints in Karamoja, let alone that anybody ever gets arrested for those complaints. So this is, quite exciting for us. And then I also have some other indicators about satisfaction in public goods provision. Really, I just want to highlight, we have these two measures. It's easy to get members of the community to come together to solve issues in the community. It's hard to get members of the community to come together and solve issues. And we actually find some joint significant effects there. These are actually, when you add up these coefficients, they're actually quite large relative to the control group. So it's, or not large, but, talking about a 10–15% increase in that, which is, could potentially be explaining some of the impacts we have. And then the big one that I want to show you is where I'm now splitting the sample based on an indicator of perceived corruption. All right, so the first two columns are these 1/3 of sub-counties that were listed as being really highly corrupt. And the last two columns are those that were really low corrupt. Now I'm splitting them because putting this into interactions is really difficult, but we've done some joint tests on it. It's basically the same thing. Nothing is significant in the low corruption areas, and that includes the joint tests with the interactions. But very, very significant for the interaction of the training and the scorecard in these high corrupt places. And so we're looking at more than an additional animal per household. Keep in mind the program delivered one animal. We're finding more than one animal, and that's translating to a 50% increase in animals in treatment households. So in places that have really high corruption, really high mismanagement, the project is working the best, and it's actually working really, really well. I also have some indicators of trusted officials and spillovers, but I won't do that. So let me just end by talking about cost effectiveness. So the impacts on welfare in the household are quite large. We're talking about between 5 to 6 additional animals. Just a rough calculation, that's somewhere between $1,100 and $1,400 worth of additional animals in the household. Again, this is only counting. I don't know anything about the quality of them. They could be extremely low quality. I'm just using an average value for a cow that you might go to a market and purchase. However, the program was not cheap to implement. We spent, depending on how you account for costs, anywhere between $900 and $1,200 per community. That's including the design, the delivering of the training, delivery of the scorecard, right, all the program costs. So you might ask, okay, the cost benefit analysis here is a little bit close. All right, under some scenarios, we're not very cost effective. Under others, we are just barely cost effective. Of course, keep in mind that if you wanted to take all the money that we spent from this program and just transfer it directly to the communities, I just showed you some evidence that there's a lot of problems with getting animals and quality things to the communities, so it's not like you're really going to get $1,200 worth of animals to that community. All right? But we also can't, though, monetize attitudes towards the central government, which I didn't show you, and then the other program spillovers. So we don't know what this is going to matter for schools, and I couldn't monetize that even if I wanted to. But, and this is where I use the term distributional impacts, you know, in places where there are really big problems with service delivery, you know, highly corrupt places, we're seeing effect sizes of 2 to 3 times. All right, so this is now, you know, significantly larger effects in those specific areas. So my average treatment effect is this, but once we start talking about the worst areas, the places that probably need this program the most, then the effects, you know, get huge. Now it'd be nice if in the future we could just target these programs into areas like that. So that's actually something I'm doing with the government of Uganda right now. We're actually trying to, so this program is being, similar interventions being done in Liberia and Sierra Leone, and the government's about to expand this from, you know, we did it in 1,000 communities, they want to do it in 10,000 communities over the next 5 years. And so I'm working with them to evaluate how they're going to expand that and how they're going to be able to make that work. And hopefully run at least 1 or 2 experiments on that to see if the expansion is also going to be, you know, as impactful as what I wouldn't call a pilot, but you know, a smaller sample size. And then finally, just the last thing to say is, you know, on policy implications. So, you know, I think we provide evidence that it is possible to get citizen engagement in poor communities, to demand higher returns from public investment. It's, you know, what we show you is large-scale, government-led. You know, the impacts are really important in places that have serious problems. And, you know, getting again to the context, you know, I think, you know, information, at least in this context of what I'm presenting today, information is only going to be able to be used if people know what to do with it. And so I think the trainings were really important because they taught people what to do with that information once they got that scorecard, once they were told, your project is not doing well, and there are other projects in your area that are doing well. It's just you guys. So, you know, our argument is that this approach looks to be feasible, impactful, and, depending upon how you do it, perhaps a good value. Yeah.
I'm not sure if you showed it earlier, but so the benefits of the treatment are with the intervention are approximately equal to the cost. What about the grant money or program money without the treatment? What does the control cost benefit analysis look like?
I haven't done that. So what I would have to do is back out how many animals, right, so how many animals is so the problem is I don't have a baseline. So I can't, you know, track how many animals they had at the beginning and how many animals they have at the end. So I know in the end they have, you know, on average 2.3 animals, but, you know, I don't know what that changes over time. So I think it's a little bit hard for me to comment too much on what the control group is.
How much are they spending on, you know how much they're spending
Yes.
on those 2.3 animals, right?
Yeah, I can back that out.
Yeah.
So it's less than $600, $550, something like that. Fine. Yeah.
So, I may have missed this part, but if a household is in a control community, or they're actually a control household within that community, are they observing that they are in fact actually part of the study? Is the community level and the household level observing that they're actually part of the study?
So we made big efforts to, so I didn't comment on this, but I should have. When we went in to deliver the scorecard, it was the research team that delivered this, but we told them we're there on behalf of the Inspector of Government. So all the programming happened without the research team's involvement, or at least without our labeling on it. People certainly were aware that we came in and did surveys with them. Now our first assessment, we never did a baseline, so they didn't know they were being watched, basically. Our first assessment, okay, maybe we're being watched, maybe we need to get things together. That's entirely possible, I think. But again, you know, you're not finding that, you know, just getting, we're still finding these treatment effects that are happening there. So maybe everybody's just, you know, paying a little more attention.
So you've got you've got treatment effects, you're identifying a difference between your identified control group that you specifically included and the various treatment groups.
Yes.
If a community or a house, if a community in particular, I think in this case, or maybe a household, was actually not part of an identified control.
They're not in my sample.
They're not in your sample at all, but there is something that's different about those communities' experience, right? Because they wouldn't have also had these quasi-IG inspectors that you know, come through and give them a scorecard, is that what you're saying?
So
Because what I'm getting at is it, do you have a lot of confidence, or are you not even making any statement about whether your controls are as close as you can get, you know, almost a baseline of what would have been happening had you guys not even been there?
So I didn't show you this analysis, it's in the paper, which I didn't share, so sorry about that. This picture, I told you not to pay much attention to it other than say that, you know, the projects are distributed around. I'm actually showing you the number of treated communities within a given parish. So a parish sits between a sub-county and a village. All right, so I'm just aggregating it to kind of like a medium level. So you can kind of see that there are some areas where we have, basically, this is one community that's a control all by itself. And we've got, you know, some parish over here where we got at least 3 or more projects within that parish. So there's a huge density there next to a place that had 0. All right, so I've actually, what I'm showing you here is that it's hugely distributed. I did not stratify my randomization, so this just comes out of the natural randomization process, but I can use this to do a spillover analysis where I look at whether, you know, how many other communities were treated in your area and whether that changes control groups in that area, and I don't find any impacts. So I'm not saying that my control group is perfect, but it's,
Just so my point's clear, to the
Yeah.
extent that there's even any value to it, I'm trying to push thought about whether there's any kind of bias in the way you're analyzing and concluding things that would actually, once you thought about whether this bias exists, would it actually strengthen your conclusions on what is working?
Oh.
Because the areas that work identifying controls, there is at least a little bit of a presence of, like you said, I'm being watched. Whereas the other areas, apparently there's none of that, at least none that you created. And so it might be reasonable to think that the controls actually could have improved just a little based on if they weren't part of the
So I think that's absolutely possible, and I wouldn't have any evidence for it other than say that I do this spillover analysis and it doesn't look to matter.
Okay.
But also, you know, if you're worried about other things that may be creating bias, we also do an enumerator experiment, which I mentioned, where we randomized which enumerators are going to which households, and we're looking at whether or not households are telling the enumerators different things. And you know, we're looking at a wide range of things, and some, there seems to be absolutely no bias, and on a few things, really sensitive stuff, there is some bias. But on our cattle, our asset that we're most interested in, there's no bias there.
Okay, so can we take one more?
This gets back to the general equilibrium question I had earlier. In Steve's sense, your control and your treatment guys are close. If the ag markets are also in the same
Yeah.
neighborhoods,
Oh,
the
yeah.
cows can be coming from the controls,
Yes.
being sold to the treatments. The assets convert to
Well,
the controls, which is Steve's point.
Theoretically, they're only the controls are only selling the animals if they're about to die. That's, you know, at least the rule, or they just want to sell an animal. So I mean, if you are looking at, you know, this control community is selling some animals here, you know, I don't think that's a negative impact on that community. If anything, that would be a positive one, because you know, you might imagine that the price of cows is
it's a
going up.
spillover, so you're getting a positive in the treatment, you're getting a positive in the control.
Yeah,
Which
positive,
is
yeah.
Steve's point, is maybe the
Yes.
bias.
So
Maybe.
what I don't want to put too much emphasis on, especially since I don't have a baseline indicator of it, is I don't want to say too much about the fact that the control group has, you know, a 2-point some animals. That's just not something that I can.
Because this
Pretty much
control
what we
meter
do.
is post, or
Yes.
is it the difference?
No, it's the post. It's the post scorecard and training treatment.
So if they sold an animal, they had 3.1,
Yes.
and now they have 2.
Yes.
Okay, so let's give a clap to. And I hope not going to Liberia because that's a heaven for